because I say it like I'm a part of this group.
You are so not a part of it.
Yeah, I'm not. Either you're a mother, a respecting mother, or a grandmother in this group, and this is primarily focused around mental health because it is Mental Health Awareness Month. So my question to start this conversation is, why do you think that it is so important for mothers to take care and monitor their own mental health throughout the pregnancy, throughout being a mother, throughout the entire time? Do you think it's something that happens? Do you think it's something that's actively looked after? Do you think it needs to be taken more care of? Do you think there needs to be more focus on it? Do you think that it should be talked about more? So that's my launching question.
Are we allowed to talk now?
Go ahead.
No. There definitely needs to be more focus on that, I think.
Yeah.
Like, it definitely gets neglected way too much.
Focus on care for moms.
For moms, yeah, because it's like a domino effect on the kids.
One thing that I actually really liked when I was just postpartum and I'd started working with my pediatrician is they actually would ask me about how I was doing. And I thought it was a really good place to screen, because when you go to your OB, you only go one more time after the birth, or typically only one more time. And they don't really focus on the mental health side. So it was reassuring for me to know that there was an extra set of eyes out there.
And that's a really important time because it's so hormonally changing. You have this baby, you have no sleep, your body's completely changing again. And although I don't know how recent you had your children, but I do know that there are some OBGs in the area who are trying to bring in mental health staff to have them available. Yeah. So I think it's getting a little more traction than it used to have. Yeah.
I think it varies, and one thing, because I have a specialty in peripartum mood and anxiety disorders, that it's really not really focused. It's more focused during the pregnancy, and then they only consider, at least this was what I was told about 7 years ago in my training, that postpartum was the first 6 weeks to 3 months after the baby was born, and I'd be seeing moms like a year out, still really struggling, but they had started struggling earlier, and kind of slipping through the cracks.
Do you think that if they had gotten treatment early, maybe they could have resolved all these issues and they wouldn't still be dealing with the postpartum like that far into it?
Yeah. Or they would be in a vastly different spot.
I was like, I know, like, going through everything now, because I'm still with the baby, is they always screen for depression and anxiety when I'm in there. But like, even like some of my clients, we've talked about it before they had the baby. Like, what are your concerns, like,
Plan for it.
Yeah, to help eliminate that postpartum depression, because that's a lot.
At least the intensity or the duration. Yeah.
I had it severely after both of my pregnancies, and I didn't have anybody looking after me. I had to look after myself, and it was hard. So I'm alone a lot with the kids. So it's
that
definitely
isolation will do it too.
Yeah, I was a stay-at-home mom for 10 years.
Oh, wow.
So it was a lot.
That's a lot. I think that's a thing for single moms as well, is there's a ton of isolation and not always a lot of help, and finding themselves alone a lot and taking care of kids and being overwhelmed and all of the pressures of that.
Absolutely.
Transitioning over to the actual lifespan. So you have the pregnancy, you have postpartum, but how about in the duration of raising the child? So, I mean, you got 18 years now.
Oh, it goes on
It's
beyond
18
18
more.
years.
Yeah, well, 18
It never
years
stops.
plus.
I have a 20-year-old.
Yeah.
What are you talking about? I still call my parents.
Yes, I call my mom
I call my mom. My mom is my therapist, my poor mother.
Or I call my mom, Mom, did I do the right thing momming my child?
Yup, all the time.
So how's that relationship work? Is that more so your guys' moms, or still the backbone or the person that you go to for reference for that? Or is it more so, does there need to be a more focus or multiple check-ins with mothers as they go through the lifespan of the child? Especially maybe in that difficult teenage.
Oh, yes,
Yes.
there definitely needs to be that. We're starting all the women growing up part now, and I don't know what to do. I feel like I cry more than anything because I'm like, I don't know how to handle this, because my mom didn't talk to me about it. So I don't know, I had to figure it out by myself. Now I'm figuring it out all over again.
You can come talk to me after the camera. It's okay. It's okay.
But I don't know, it's frustrating.
3 teenage
And then
girls.
I don't know what to do for myself to calm me down for that. I don't know.
That one I run into because I don't have the teenage years, but I have a toddler and a 6-year-old.
Mhm.
My toddler is currently lucky to be alive.
Let's cut
Because,
that.
yeah. No, you can keep it. I tell my clients that all the time. The last how they're doing, they're alive. But yeah, being able to come back and say, okay, how do I calm myself down? Because if I'm in a better spot, they react better. But then also for me, when I'm not and I'm having a tough time, being able to cope with, oh my God, I'm a terrible mom. I'm horrible.
All the self-shaming.
Yeah.
Yeah, that
And
follows.
especially I think with social media now and this idea of the right kind of parenting or this, what is it, responsive parenting or not, the old school way, and then having to try and deal between the generations of how, I don't
Yeah,
know.
and kids know it all now thanks to social media. So, yeah.
Well, and Google.
And Google.
I think
Yeah.
that's the hardest part too. Again, I'm not there yet, but like, how are you supposed to sit there and feel like you're being a good mom, right? And like, what's normal? But then all of a sudden, you have all this outside stuff coming in into your homes now. Again, and you can only, block,
Filter.
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 So
There we
much.
go. That's the right word. Yeah, filter it, and then what? What are you supposed to do?
Well, and I think the thing scary about teens, like with toddlers, I think, like, you can pick a toddler up, which is good. But with teens, you can't pick them up, and they're so mobile. So
I just
they
sit
can
on
go,
mine.
yeah,
Just sit
but they
on
can
mine.
go anywhere. You know, like when my sons were in their teens, the older two, we lived in a city. So there were times where they just got on a train, and I wouldn't know where they were for hours on end sometimes. But, you know, I think with teens, it's not just about the way they make choices, but sometimes how scary those choices can be because it can harm them, and you're trying to communicate that, and it's really hard. It's a little frustrating because you're not trying to just say, I'm worried. You're trying to say, I don't think that's going to end up well for you, and your experience or wisdom is just kind of discounted. Yeah.
Well, I feel like sometimes my mother thinks I'm too honest with my kids about life in general, but I've found that because I'm overly honest with my children, they're very honest with me, and they feel like they can say anything to me because I'm not going to judge them and I'm not going to get upset. They're going to talk to me, and that's kind of my philosophy of parenting.
I think it's a good
guess.
approach.
Especially since they've been
'Cause if you don't
teenagers,
tell
not when
them-
they were younger,
Yeah.
but
Because if you don't tell them, somebody's going to tell them.
somebody's going to tell them.
Exactly.
And
And
the
if you
wrong
don't talk
person.
about it,
Right.
they're going to think, well, why aren't we talking about this?
Right.
What's the appeal or what's wrong? And then kids want to experience that, you know. So.
Yeah.
So what do you think moving forward? I mean, obviously there seems like there is somewhat of a lapse in, obviously we talked about it in the beginning when during the pregnancy and postpartum, and there's therapies that are offered for that. But obviously we're talking about in the realm of the rest that's there. It seems like there's not really anything there. It's kind of like figuring it out or either talking to your mom or if you don't have a mom to talk to. So what do you think would be how do you solve that issue? How do you make sure that new moms or moms that are in that very difficult period of life that may not be able, you have your spouse or husband or baby daddy or whatever to kind of talk to about that information. However, he's obviously not going through it like you're going through it.
I'm actually going to add a slight disclaimer, even though this is a mom's group, is that dads can also experience postpartum and
Correct.
peripartum stuff. So it's not solely women, because I've also treated new dads with postpartum.
That's a Father's Day conversation.
Yeah. That's a Father's Day.
Leave this
But
for
to
us.
answer your original question, I think mental health for everyone.
Yeah.
I don't know, I think it's an accessibility.
Easier access to mental health would
Yes,
be amazing
would be
because
great.
I'm starting my own mental health journey because I need it being a single mom now on my own and I'm struggling and it was hard to find somewhere I could go and afford. So and
Yeah.
and it's something
And
is
that is the
necessary.
dilemma a lot of times. It's not that women don't want to go. I have moms who bring their kids in, and
I do
it's
too.
obvious to me they need counseling.
Mm-hmm.
And like, how can we get you into counseling? What can we do? And there's not enough time in the day.
Exactly.
If she's working, if she's doing all the stuff for the kids, if she's a single mom, you know, it takes a lot. And then you and I have talked a lot about, we have a lot of grandmom moms. So here's
Yes.
grandmom who's in this stage of life where it's like you're supposed to overfeed the grandkids, you know, fill them up with sugar, send them home. Well, their home is your home.
Right.
And you're doing all these things all over again in a time where you didn't know you were going to do it. You didn't create the situation, but you're the fix for it, and sometimes the only fix for these kids. So if you walk away, then there's nothing.
Right.
Yeah.
I mean, and when I've talked to those clients, a lot of times I'm like, I get it. It's hard. How are you supposed to do that dual role, right? Because, you know, again, you want to be that loving grandparent, but at the same time, you're their parent. So you can't just like, it's not a switch. You can't just turn it off and turn it on when you want, kind of thing. And
Right.
then you feel like you're not doing your best.
Yeah, and actually I've had folks where I've had parents who are kind of the middle of that, where they're living at their parents' house. And I actually have been in that situation where I've lived there with my older son. And it was a conversation that we'd have with my parents where I'm like, okay, you're the grandparents, and just because you're here doesn't make you the parents, but I understand the differences and how to have those conversations. And then with some of the moms that I work, or it's moms and dads, but the folks in that kind of sandwich generation, trying to take away some of the shame, because it's so prevalent right now.
But I think what you said was really good, is having a conversation about where to put the boundaries.
Yes.
Because that's when everybody's really clear on that communication, like, this is the role I see, and this is the role that I'm hoping that you will take on, because we're in this situation, it's temporary. Yeah.
And even that being said, it was easier because I have experience in knowing that, but it is still a hard conversation.
Yeah.
And when you get into some more difficult family dynamics, how do you figure that out?
Yeah, it is difficult because it's uncomfortable.
It really is.
Yeah.
That's a lot.
How to be comfortable with the discomfort, because it has to
Mm-hmm.
happen, otherwise dysfunction creeps in. Yeah.
Do you think that some of these, some of like the Facebook mom groups and stuff like that, is a help or is a benefit? Or
Yes.
do you think that sometimes it's
It depends.
The uterus
I was
group is
gonna
a great
say
one.
depends.
Which one?
The uterus group.
Oh, I don't know about
It
that.
is-
What's that?
I
I
have
have
several clients in.
That
I
is
did not know
the
about that.
best group ever. You can get anything you need from them. They're better than a phone book. They're better than a therapist. I mean, probably not really, but I have made so many friends from there because they connect. Like, we've been on like the same level. We're going through the same things. Like, we can't leave our husbands yet, but like they want to do that. So it's like we can all talk about that stuff. So it's easier to connect with people going through the same thing.
So it sounds like it normalizes a lot of
Yeah,
stuff.
and like it makes me not overthink it as much, and like I can do that on my off time. So like, oh, the kids are in bed, I can go talk to people on the Uterus Club because that's where I can meet them.
And actually, when I first had my older son, the breastfeeding group through Dover was a phenomenal resource, because you'd have other moms up at 3 a.m.
Yeah,
and you could just
Struggling like
you could
you.
post, and then they'd
That's
comment. But I think it really depends on having very firm boundaries around having healthy interactions
Mhm.
and not
Mhm.
shaming or any of the rest
Yeah.
of that.
Or rescuing, which
Yeah.
there's where women really tend to, yeah. And I think the support groups is a huge thing for women. One of the things I had read about breast cancer survival rates was, in the beginning, it was so high because it was one of the first groups made for people with cancer, and they started seeing women were surviving. And that's the one benefit that women have, is we can come together, we can be really supportive, and the groups are really good.
Mhm.
Yeah, I think the support groups help.
Mhm.
Any questions that anybody would like to launch?
Me?
Don't you have a question?
Mm-mm. So some of the stuff I wrote down. So one of the things was, and we're kind of talking about it, is, you know, moms and social media, and how moms and grandparents strike a balance. We're not going to be able to take social media away from our culture. There's no way to take that away from kids, and it's a great tool for behavioral initiatives sometimes. but at the same time, it's a dangerous thing. And how do you, and I think moms and grandmoms as well find that really tricky to navigate sometimes. You don't want your kids on there looking at things they shouldn't, or you don't want them exposed to people who could be dangerous or harmful to them, and yet you want them to be able to connect and do all the things. So I find that social media has been another one of those, and I don't know if all of you have experienced that, and what you've helped either with your children or with clients who've had those issues.
That's a time I'm really glad I have young kids.
Yeah.
I mean, my kids live on it, and then when I
Yeah.
do, I'm like, okay, it's time to end it. It's
I mean, I
World War
see
III.
toddlers
It's
on
World
it
War
now.
III.
Toddlers
Yeah,
working
it's the
iPads.
worst.
If they
So
have
how
to
do you
know how to
handle
use
World
their
War
device.
III?
I send them to their room.
So
Because
there's
at that point, I need a
consequence.
breather. Yeah.
Right, there's
Yeah.
consequence.
Yeah, I need a breather at that point.
So that's excellent, because that sounds like self-care. So the boundary falls in, you had an opportunity, I let you do this, but now you're off, and if the behaviors aren't right, you get a consequence, but I also recognize, like, I need a break from all of this as well.
Yeah, so I don't yell at them or,
Yeah.
because at that point I'll get really mad. And I'm like, no, let's stop it before I go there.
Yeah.
Actually, that's a big one I use both for myself and I talk to clients about is I'll sometimes give myself a timeout.
Exactly.
Like,
I just
I'm
don't
gonna go
ever-
take a timeout.
Yep, shut the door.
Mhm.
My husband will come in and like, what are you doing in here? Just leave me alone. Give me 5 minutes and I will get back to momming or wifing, whatever you need me to do. Just give me 5 minutes. I just need to cry, sit in a corner by myself, just let me go.
Take a walk.
Yeah.
Take a walk.
But that's the stuff that's not talked about.
Yeah, and it should be.
Because again, you feel
Yeah.
guilty. Oh, because I need to take 5 minutes for myself to just collect myself. But then you
People make you feel bad about it.
Yeah, moms aren't really supposed to have their own time.
Moms don't get that.
right.
Yeah, exactly. So I think the expectation has to change somewhat on what we put on ourselves, and
Yeah.
that's another thing about social media is it generates all these concepts about, and we talked about earlier, you know, good mom, or this is what it should look like, and good moms have bad days, and there's no way around that.
They just don't picture them.
Yeah, yeah,
That's
exactly.
very true.
Where do you think that pressure comes from?
Society.
Society, yeah.
Seeing
Or just-
better moms or thinking better moms.
It also
And
comes
then
from
Not supportive
yourself.
spouses, yourself. Yeah.
Because you put so much on yourself to, you know, you've got these lives in your hand,
Mm-hmm.
and you want them to grow up and be happy and healthy and not drive them to, you know, something you don't want to drive them to.
I think there's been a generational shift.
I was gonna say that.
And because I see a pretty wide range of folks, because I pretty much see 18 through, I've had someone who's 92. And what I see from the older generations is this you have to keep things looking a certain way. You need to present what's okay. And those tend to be parents of the parents now. And so this, again, the sandwich generation trying to figure out, okay, yes, there were some things that were good from that, but hey, there's a whole bunch that got screwed up. So hey, let's go see mental health. But then how to try and do better for your kids. And there's a lot more moms in the workplace. And at least in my family, we're lucky enough that I'm the primary, for lack of a better word, breadwinner. And my partner stays home. And I have two thoughts there where I struggle with, okay, how do I be a mom and connect, but I'm also working and I feel like I lose out, and you can't do it all. The other side of that is, and I hear this from my partner a lot, like if he's at the gym and he's got our kids and all the older ladies, like, you're such a wonderful dad, you're doing all these things, my husband never would have done that. And I feel like we need to normalize co-parenting. He is also a parent.
It's not babysitting.
No.
The man has the kids, although for some
Exactly.
reason that's what it's viewed as. The man is babysitting, the mom is the
Where the
kid
mom's
taker.
just expected to be the one. Yeah, yeah. And I think you touched on something really good, which is the generational thing. I think when a lot of these expectations came on women, you know, and poor June Cleaver, but, you know, she's kind of the one, you know, vacuuming with pearls on. But women had different time structures back then. We have working women now, and we mentioned it before, single moms. We have games and soccer and all kinds of things that kids do that in the past kids didn't really do a lot of stuff like that. There weren't as many organized sports or teams and things. And time structure, sometimes I just see women running from one thing to the next to the next, and that's hard. You can't keep up all the things that used to be with the current way that we live life. We live life fast.
Yeah.
Yes.
Well, and I think the pressure on kids too is, okay, if the idea is potentially to go to college or be set up, I mean, there are people who start considering that in grade school and what sports to get them into and what type of sports, and that just makes it more racing around.
All that much tougher, yeah. Yeah, it's a lot of pressure. It's a lot of pressure. So I wonder too, if we talk about what are some of the poor coping ways that we've seen ourselves or moms that we work with who deal with the pressure, deal with the stress, but do it in ways that aren't necessarily as adaptive as other ways.
Just ignore it. Just push it down.
Well, that's the issue.
That's
We
a-
gotta fix that.
Yeah.
No, I know. I'm
One-
just saying that's.
What I hear
that's
from
my
folks, and I'll own it too, is yelling.
Oh yeah.
That outlet. So shutting down, yelling, yeah, all those things that we use adaptively that's really maladaptive. Yeah.
I'd say lashing out, because I've had some where they've like lashed out on either their partner or their support system, for sure.
Or maybe even the kids.
Yeah.
And that makes you feel like a crap parent.
Yeah, it's like a double-edged sword there.
And people don't talk about that as much, but it's happened to everybody at one point or another.
But the double-edged sword, right? You feel shame for not being there and always being on point, and then if you have that bad blow-up day, then you have shame for that as well. And I think helping women look for better options, and I think we've done well recently in the last several years with destigmatizing mental health, and it's, you know, I have clients and when I see them out, they're like, oh, this is my counselor, you know, like they introduce me to whomever they're with, and I'm like, okay, it works for me. And I think that's the way, you know, all that normalization and just giving women a place to go where they're safe and they're not judged and it's objective.
Yes.
Um,
Go
ahead. No, go for it.
This is kind of like gonna go a little off, but it's still touching on it. Of like the normalizing is because I've been going through the pregnancy now, and I'm like, how come a lot of moms don't talk about this stuff? Like everyone's like, oh, pregnancy's great. There's amazing things. It's amazing, but then you don't talk about the other stuff. And isn't that what kind of causes more of that depression after the math? Because you're going through these things. Again, you don't know your body's going through these, and you're like, what is this?
Because sometimes people get judged for this complaining. If you talk about the negative side of things, then you're complaining.
But again,
And
it's
we
like,
should
no, it's real.
discuss it because
Yeah.
being a pregnancy is great, but it's also awful.
See, some people have great pregnancies. I was not one of them.
There's aliens growing in you.
Yes.
And they sit on everything. It's very uncomfortable.
Yeah.
I loved it.
I did too. So
Yeah.
yeah, I loved it.
Another tangent that I was also thinking of, just some of the other judgment is, I think, in one way, having Child Protective Services become much more prevalent and doing a better job, on one hand is good, on the other hand, I don't know how many times I have folks go like, can I even say that I spanked my child?
Yeah.
And or if I'm like really frustrated at the door, I'm like, is someone gonna call CPS on me? Because and for me, and even for me, like that's terrifying. Even if it's just like I'm not doing anything to harm them, even though I know the things that would be reportable or any of the rest of that, people also make false.
Right, the
reports.
lines can be thin sometimes.
Yeah.
I think it's a little scary. Yeah, and that's another pressure point.
Yeah.
So what do you do in that situation then? Like say somebody, they overhear, they misinterpret, like right, you're at the store or something like that, and something, you get a case, and then they start digging in. What are you supposed to do as a mom? How are you supposed to work through that?
Yeah. I mean, once something's open, you got to go through the process. But
So just prove you're a good mom that you are.
Yeah.
Even though you're gonna doubt yourself the entire time it's open. But
Yeah.
Prove the case. Yeah.
Or one thing I hear a lot of, and I try and reiterate with folks, is let's say they are already in therapy, or sometimes I've had folks going through a divorce and mental health will come up, and they almost see it as a weakness that they're coming in for therapy, or that they've had problems, or they're on medication. And I try and reaffirm that something's going on and you're taking care of yourself. Like, let's say you were diagnosed with diabetes, you need to do the things to take care of yourself there. Mental health is the same
It's
way.
the same.
And if you're coming in for therapy, if you're taking your medications, if you're active in all of these things, you're doing exactly what you need to do.
And that's not to get personal, but I am in therapy. I see a psychiatrist. My parents hate that I take medication or that I see a therapist because they think I don't need that kind of stuff. But like they don't live my life, so they don't know what goes on behind the scenes, just what I tell them.
Yeah.
So like when she's like, "Oh, don't take that. That's gonna hurt you." Like, it doesn't hurt me. It makes me better, so
Right,
that
the
I
doctor
don't hurt
prescribed
myself.
it,
Like,
right,
yeah, it's
based on what
prescribed.
my
I take
needs
it.
are.
Exactly.
Yeah.
So that parents judging and everybody on the outside, that's very frustrating too. Because I'm like, my kids wouldn't be happy if I wasn't happy. So.
Right. And that's where I think counseling and psychiatry is even more important, so that you have that support saying, no, this is right for you and this is the right thing to do, and looking at those measurable goals to say, okay, since you've been taking medication, are you measurably better?
Yeah.
Are you meeting goals?
Yeah.
Are you happier? Are your kids saying, wow, we
like,
are
I have my
much
mom
better?
back. Yeah.
I have my mom back. And I think those are it's the outcomes that you have to look at sometimes, not people's opinions. Yeah.
All right, so we're reaching our 30-minute mark. Is there anything that you guys would like to wrap up with? Any comments, any advice for new mothers or current mothers or
Old mothers?
old mothers?
Breathe.
Yeah. Talk about it, like legit, you're not complaining. Again, talk about that. Ask those weird, uncomfortable questions again. Saying, hey, is this okay? Is this not okay? But even if you're not looking for their advice, just
It'll make you feel better to ask it.
yeah.
Take it easier on yourself.
So for me, it's very validating to know other people experience the same thing.
Yeah.
Yeah.
And I always think of it like going through the store. If there's another parent, well, my child's
Don't
being the one, and they're like, "You got this."
Yeah.
I try and pay that back in kind,
Yeah.
but if I hear another parent, I'm like, I'm not judging.
Sometimes affirmation, just even a little affirmation, goes such a long way. And as opposed to calling it complaining, I think we could call it educating. We're just trying to educate each other, because different stages of life require different things, and you're in a stage where you're trying to learn all the newness of motherhood, but then motherhood has, the toddler, the teenager, the adult and grandchild stage. And I think having other women who've gone through the experience and normalizing it and making us feel like we're not the only one going through that, it's very affirming.
Us moms have to stick together.
Yes.
That's right.
Yeah, absolutely.